How long does it take for gabapentin to work? Gabapentin usually kicks in within 1 to 2 weeks. Most people feel some relief, but not everyone. Gabapentin can take as long as a month to kick in for some people. It usually takes 20 to 30 minutes for gabapentin in the body to absorb. It is possible to notice a difference in your pain within 1 to 2 weeks of starting the intake. However, this may not be the case for everyone. It takes between 20 to 30 minutes for the drug to absorb and 8 hours to reach its half-life. Doses range from 100 to 4,200 mg per day. How long does it take for gabapentin to work? It is also said that gabapentin's peak concentrations, which are immediate release, occur in as little as 2 to 3 hours. Although pain can subside in a few days, symptoms can resolve within 2 weeks. You may also notice a decrease in the frequency of seizures within a few days. Experts are still unsure how gabapentin functions, but research has shown that gabapentin appears to bind to a particular site known as the alpha-2 delta site of voltage-gated calcium channel. This is how gabapentin's anti-seizure and nerve pain properties are explained. How long will gabapentin take to work? Gabapentin may take up to 2 hours before it starts working. This is because the medicine's peak concentrations are reached at this time. Gabapentin may not start to work on nerve pain or sleep problems for about a week. However, it can take up to a whole month for the drug to begin to treat nerve pain and nerve damage. What is the average time it takes for Neurontin's effects to take effect? Neurontin can take up to 2 hours to reach its peak concentrations. While Neurontin may relieve sleep problems caused by nerve pain within a week, it can take longer to treat nerve dysfunction-related pain. What is the average time it takes for Neurontin's effects to kick in? Gabapentin is known as Neurontin. It usually takes 1 to 2 weeks to kick in. Neurontin or gabapentin is a pain relief medicine. In the case of immediate-release medication Neurontin, peak levels can be reached in about 2 hours. How long does gabapentin take to adapt? Gabapentin can take up to a week to adjust. Gabapentin can be adjusted differently for each person. Gabapentin takes approximately 1 month to show full effects. Gabapentin should be taken before you take gabapentin. Gabapentin can cause serious breathing problems in patients with COPD or chronic obstructive lung disease, COPD. You should seek medical attention immediately if you or someone else experiences slow breathing. Gabapentin allergy is a reason to stop using it. You should not use dialysis if you have kidney disease or are currently on dialysis. Depression or mood disorders can lead to suicidal thoughts, behavior, and actions. Be aware of mood changes and symptoms. Any symptoms should be reported to your doctor. If you are suffering from drug addiction, it is not recommended. If you have liver disease, it is not advised. If you have a heart condition, it is not advised. You should inform your doctor if you suspect that you might be pregnant before you start the treatment. It is still not known how this medicine could harm unborn babies. If you are nursing, it is not recommended. Ask your doctor for any concerns. What should I do? Gabapentin must be taken exactly as prescribed by your doctor. Follow the directions provided by your physician. Your doctor will not allow you to decrease or increase the dose. Your doctor might change the brand, strength, or type of gabapentin to adjust the dosage. Ask your doctor or pharmacist if you have questions about the new gabapentin type. Horizon brand gabapentin should not be taken throughout the day. It is best to take it with dinner at around 5 p.m. Gralis or Horizon should be taken with food. Neurontin, on the other hand, can be taken with or without food. You can only take half of a Neurontin tablet. Make sure you take the rest at your next dose. It is best to swallow the tablet or capsule whole. Liquid medicine must be measured precisely. Always use the provided dosing device or a dose measuring device. Avoid using a kitchen spoon. Even if you feel better, do not abruptly stop taking the medication. Sudden discontinuation of the medication can cause seizures to increase. Follow the instructions of your doctor about how to reduce the dosage. Epilepsy, adult usual dose. Initial dose, 300 mg orally on day 1, 300 mg orally 2x a days on day 2, 300 mg orally 2x a days on day 3, and then 300 mg orally 3x a day for day 3. Maintaining dose, 300 to 600 mg orally 3 times daily. Maximum daily intake, 3,600 mg orally, in 3 divided doses. The maximum time between doses within the 3 times a day schedule should not exceed 12 hours. Gralis and Horizon's safety, effectiveness, and efficacy in epilepsy patients has not been investigated.